So welcome to Voices in Health and Wellness. This is the podcast where we go behind the scenes with the people redefining what care looks like. Founders, clinicians and innovators who are pushing the edges of health one conversation at a time. I'm your host, Dr. Andrew Greenland, and today we're exploring one of the most fascinating and fast evolving intersections in healthcare, the connection between dentistry, air health and sleep. Joining me is Dr. Dar Radfar, also known as Dr. Rad, a practicing dentist, speaker and educator who's become a leading voice in air-centered dentistry and sleep apnea treatment. He's the founder of Rad Health Inc. and Rad Seminar, where he helps dental professionals implement sleep protocols, oral appliance therapy, and even low-level laser treatments for TMJ and chronic pain. He also leads patient care at 805 Dentistry in California. So with that, Dar, welcome to the show, and thank you so much for joining us.
Thanks, Dr. Greenland, for having me. I'm excited to have your listeners listen to how you can get the best sleep of your life. I mean, a third of our life is spent sleeping, right? And if we're sleeping well, how much energy would you have the following day? How much better is it to sleep next to a bed partner that doesn't snore, right? And what are the risks and prevalences of sleep? And how can you self-assess yourself? So I'd love to dive in and jump into this world of sleep. And we'll even discuss why a dentist such as myself is speaking about sleep today.
Brilliant. Well, we'll cover all of that and delve into the weeds. But perhaps we could start with your journey and how did you transition from traditional dental work into sleep-focused and airway-centered care? Because I think that'll be interesting to hear.
Yeah, I've been a dentist for almost 24 years now. In 2002, I became a dentist here in California, in the United States. And in 2009, I was driving home one evening from dinner, and unfortunately, I fell asleep at the wheel. I crashed my car into a tree, not knowing I had a condition known as sleep apnea. I knew I was getting a little bit tired throughout the day. At the time, I was 32 years old. I wasn't overweight, so it wasn't the classic large neck or fat around the neck area that would constrict the airway. So I knew I was getting a little more tired. I was starting to snore, especially if I had a couple drinks at night, but I never knew that I had sleep apnea. But after my accident, I realized that something's going on with my sleep that's making me tired throughout the day, which made me fall asleep at the wheel. And luckily, I crashed into a tree. I obviously turned out to be okay. But I got a home sleep study soon after. Who has time to go to a lab, right? And a home sleep study is a really nice, effective way that a physician or a dentist, and dentists here in the United States can definitely refer for home sleep studies to be able to diagnose you and see if you have stoppages of breathing or shortness of breath that are enough to be recorded on the device that you sleep with that indicate a possibility of sleep apnea, which means that your heart's racing to get oxygen to your brain and you're doing this mini marathon back and forth and you wake up and you're not really rested. You don't get deep sleep or REM sleep, which ultimately gives you that more energy when you wake up and more mental clarity. And so I was diagnosed with sleep apnea, and they gave me that beautiful machine called the CPAP machine, continuous positive airway pressure. And unfortunately, I couldn't tolerate it. I was claustrophobic with it. I'm a stomach sleeper, so the cord would, wrap around my head once, and the mask would come off, and it would just be very uncomfortable. And I'm sure some of the listeners here who've ever had to wear the mask, if you're not tolerating it, it's very challenging to continuously wear it and try to sleep through the night. Now, if you can tolerate the mask, you'd love it. You sleep well, you wake up refreshed. So what I couldn't tolerate, I gave it back. And a few months later in 2010, the American Medical Association approved an oral appliance for sleep apnea and snoring. And guess what? I was patient zero in my practice. We did an impression for my teeth and I made the appliance and adjusted it and boom. It changed my life forever. And since then, I've helped over 4,000 patients in my practices. And I've been blessed to teach dentists all across the world on how to do this so they can ultimately help their patients.
Amazing. I always find these personal health journeys very interesting and the way that they kind of mold what you end up doing for your career. So thank you for sharing that. Really interesting. And then what led you to launch Rad Health Inc. and then Rad Seminar to start coaching other dental professionals?
Yeah, Rad Health Inc. was products that I've created. My first product was a sleep product. In 2021, into 2020, patients would come in. I'm checking their appliances. Their dental offices were opened during COVID. And my patients were like, yeah, I sleep really poorly, doc. I don't think it's the mouthpiece, because my wife tells me I don't snore. It's not bothering me. The mouthpiece has been working great. I just can't shut off my mind. I'm like, okay, so what are you doing to help you sleep? Well, I'm taking Tylenol PM. I'm taking Xanax. I'm taking Advil PM. I'm taking Benadryl. So they're taking these drugs, and these drugs are obviously are not only liver toxic, but they could also be kidney toxic to numb the mind. Or they're drinking a half a bottle of wine, maybe a whole bottle of wine on Zoom before they go to bed during COVID, right? And we remember those days. And to shut the mind off, taking these drugs and not just taking natural supplements is a problem. So I put my biochemistry degree hat back on, and I looked up some ingredients that would help with anxiety and insomnia. And I discovered an ingredient called N-acetylcysteine, or NAC, N-A-C, that was being used actually for treatment of COVID when you have COVID symptoms as an antioxidant for your lung. And then when you Google or search NAC and sleep apnea, you see that there are NIH.gov studies that show NAC helping reduce sleep apnea by about 30% with home sleep studies. So I incorporated NAC. I put some L-theanine, some magnesium glycinate, some valerian root, which is an herb, and very trace amounts, 2.5 milligrams of melatonin into my supplement. And I created my first sleep supplement called RADZZZ, under the Rad Health Inc. brand. And patients were clenching and grinding their teeth a lot. They're stressed more than ever before. 20 years of practice, I've never seen so many people clench and grind their teeth because of the stress that they were going through from what was going on in the world. And so I created a TMJ supplement called Rad Jaw, which also has 7 all-natural ingredients to help alleviate the tightness of the muscles of mastication and help rehabilitate the joints that most people experience with popping and clicking and locked jaw through modalities of ingredients like chondroitin sulfate, glucosamine, vitamin D3, calcium. And so that's how Rad Health Inc. started. It was a necessity from what I saw my patients suffering from with sleep and TMJ. So I ended up making some natural supplements because I was concerned about the liver and kidney toxicities that the prescription or over-the-counter medications were causing.
Got it. And you also mentioned on our call before that you'd also developed some low-level laser therapy products. And now I can see you've got these supplements. So can you kind of tell us a little bit more how all this fits together in a kind of a holistic approach to some of the conditions you're seeing?
Yeah, through Rad Seminar, I did a lot of speaking engagements since 2014. I've been on stage at all over different conferences and webinars, teaching other dentists on how to do sleep and how to treat it, how to incorporate it into their practice, what to look for in the dental area, in the mouth, and also in the medical history, to have that conversation about, hey, how well do you sleep at night, Andrew? Do you feel like you're tired throughout the day? Anyone tell you that you snore? And these kinds of conversations are important to have as a dentist because we do look in the mouth. And so we notice also airway restriction or not getting enough oxygen has a big connection to TMJ or temporomandibular joint disorder or grinding of your teeth. So a lot of the dentists typically just make a night guard and call it that's the kind of treatment that they call for. But a grinding patient could be a sleep patient, an airway patient. So we always ask about the airway, but sometimes, yes, we do have to treat the TMD. And the low-level laser therapy came into play 2.5 years ago as a treatment modality for the tightness of the muscle and pain that patients experience with skeletal muscle pain. When we clench and grind our teeth, our masseter and temporalis get inflamed. We have neck and shoulder pain typically. A lot of times we can get ringing of the ear. We get migraines. So a low-level laser therapy device by Erchonia, Erchonia, is based out of the United States, but they also have European divisions as well all over Europe. And they have a handheld device that I help use on patients to be able to help with their TMJ and TMD symptoms, to be able to reduce the pain, musculoskeletal pain. It basically stimulates the mitochondria, which is the engine, the powerhouse of the cells where the laser points. It's a cold laser, doesn't hurt. There's no numbing, no discomfort to do it, no contraindications. You could use it on a baby. You could use it on a horse. And the average person that we use it on has these kinds of pain alleviate after a couple sessions. So it stimulates the mitochondria to produce more ATP, which is the energy cell of the cell. And when there's more energy to the cell, there's more reduction of inflammation, an opioid effect, so a pain reducing effect, and it promotes healing. So we've even used the low-level laser therapy. If Andrew, you're in my office and we pull the tooth and, we're going to put you on some gauze and send you home, we shoot the laser on that area where we pull the tooth. When the numbness wears off, you're going to have a lot less pain. You're going to have less inflammation. Great for wisdom teeth removal, so you don't get that chipmunk look when you get your teeth removed. But in any sort of surgical type of treatments that are done in dentistry, it really helps lower the pain, lower the inflammation, the swelling, and promote healing.
Amazing. So you've got quite a portfolio of things that you're involved with. So what does a typical day look like right now for you? And I guess there is no such thing as a typical day. But in terms of, juggling clinical practice and education and product development, what's your kind of week?
Yeah, Doc, I tell you, the people who are listening, what do we have on a typical day, right? We get up, we hopefully are thinking in gratitude. There's a mindset shift today that we're more conscious of our energies and hopefully we're not leading with a negative victim kind of attitude and mindset. So I typically like to get up and set my intentions for the day. I'll grab my journal and I'll write down 5 things that I'm grateful for and a couple things that I want to really get done today, such as doing a podcast with you. I was excited for this today to be able to share some of the knowledge about sleep and dentistry and also mindset. So once you get your mindset right, I typically have a lot of Zoom calls with dental dentists all across the world now that I teach on how to do sleep. I still see patients 5 days a month. I go into the practice and see patients from general dentistry to sleep to orthodontics and clear aligners and whatnot. So I do have a typical day with that. But when I'm on my Zoom calls, when I'm kind of discussing things that patients are experiencing with the doctors that I'm training through RAD seminar, things come up and innovations come up and ideas come up. And I think when your mind is more clear, when you're not dealing with the daily stress, you're able to think of ideas and opportunities to be able to meet people, to go to different conferences and speak on stages and get on podcasts and panels and whatnot. And during my breaks, whether I'm walking for 30 minutes after a meal or I'm at the gym, I'm listening to podcasts like yours to get information and new ideas that can help me with maybe creating another product so that hopefully we can help people lead healthier lives.
Well, fun-packed life, but also very well balanced. And I like your self-care stuff that you do. So clearly there's a growing awareness of the connection between sleep and airway health and cognitive decline. What trends are you seeing in terms of patient demand and also clinician interest, perhaps the less awakened clinicians?
Yeah, the biggest thing that we're seeing is the bed partner, right? The sleeping next to someone that snores. And my wife sent me today, Doc, because I'm snoring and she kicked me out of the room, right? The classic sleep divorce story. And it's estimated that 1/3 of people who sleep under the same household that snore, 1/3 of them sleep in separate bedrooms. And if you would imagine, that does affect intimacy, ultimately. Some people like sleeping in separate bedrooms. They like their privacy. But at the end of the day, it does affect intimacy in many different ways. And also, it's for that person who is dating, right? They're on the dating scene and you meet somebody and you become intimate with that person and you may want to sleep over or they sleep over and you snore. That could heavily ruin the relationship. So we've got a lot of social implications of sleep that we're talking about. And of course, the medical comorbidities or the medical things that pop up are things like high blood pressure and acid reflux. The risk factor of cancer, 5 times higher risk of cancer of any kind, a University of Wisconsin study here in the United States, if you have sleep apnea that's left untreated. I always start my lectures when I'm on stage to say, Google, talk into ChatGPT or into Google life expectancy and sleep apnea. You'll see that most studies show 10 to 20 years off your life if you're not being treated for it. And so the medical comorbidities are there, including depression and anxiety, the mental health effects that lack of good quality deep sleep has and sleep apnea can cause. And in the dental world, which we look in the mouth every day on your checkup appointments, on your crown appointments, or anything like that, the dental implications are very high. And the listeners here, I'm going to give you some pointers. So the self-assessment here, grinding of your teeth. If you see your lower front teeth wearing down, you're grinding your jaw, moving it back and forth, you're trying to keep your airway open in the middle of the night. That's a big indication that you may not be getting enough air. Large scalloped tongue. If the width of the tongue is really wide compared to the width of your arches of your jaw from left to right, the tongue doesn't have a place to sit against the roof of the mouth or on the floor of the mouth. And so it tends to fall back and cause that obstruction. The tongue falls back, hits that soft palate where the back of the throat is, where that punching bag is, called the uvula. And that can cause an obstruction called sleep apnea. And the vibration against it is called snoring. And so these are some of the landmarks that we look for in the mouth. Dry mouth is another indication, a mouth breather. And these aren't just for adults, Doc. It's very prominent in children. If your child grinds their teeth, if your child snores, that is a huge red flag. That is not cute and funny or just like dad. That is a red flag. They should be evaluated by the pediatric ENT right away to make sure their adenoids and tonsils are not causing the obstruction, which would require pediatric ENT surgery. And they should be evaluated even at the age of 4 or 5 and up for orthodontic evaluation to possibly expand their jaw to create room for the tongue. If their jaw is very narrow, our jaws are becoming more narrow nowadays because our foods are more pureed as we're getting, as children are growing, and they're not eating meats and stuff like that as much. So our jaws are more narrow and tight, and that causes more obstruction. And if the jaw is further back, the lower jaw is further back, so the kid has an overbite. That's an indication also that possible sleep apnea and snoring can happen in the child. And that can be corrected with functional appliances at the age of 4, 5, 6, before all the adult teeth are in, so that it becomes a lot easier because they're developing at this time. So this is very important in the pediatric world as well. Bedwetting, ADHD symptoms are reduced tremendously when the kids are sleeping better and getting enough oxygen. So we touched a lot on adults and children. So if there's any snoring on kids, any ADHD symptoms, bedwetting, grinding of the teeth, dry mouth open breathing, please have it evaluated by a pediatric ENT and an orthodontist.
Great message. Now, we had a conversation before because I have a particular interest in Alzheimer's disease, and I'm very well aware of the link between sleep apnea and Alzheimer's disease. Can you share your thoughts on how dentists are becoming more central in identifying these risks?
Yeah, after 24 years of being a dentist, it's sad that sometimes I have these patients that we've had relationships with, right? If any of the doctors are listening, there are some relationships that we've developed over the years with our patients that are truly, I call them friendships, especially in the dental community. We see them every 3, 4, 6 months, and we know a lot about their families. They sometimes know about ours. And so when I see them progress into Alzheimer's and they come in and they now have a caretaker and they can't remember a few things from the last time that they came in and whatnot. And I see the symptoms. I see the signs of sleep apnea. I see the signs and wear and symptoms of sleep. I also see the signs of gum disease, the correlation between bacteria and gum disease and the connection to the mind and the cognitive section of the brain. You can desiccate the brain from oxygen because you're not breathing well. That'll ultimately kill brain cells. But also gum disease is a big link not only to heart disease, which we've known, but now also Alzheimer's. So floss, water pick, and brush your teeth. Get into the dentist every 3, 4, 6 months. Get your cleanings. I love water swishing. Today I was having, look at this shake here. It's a bunch of blueberries in there, a chocolate protein shake. And that kind of makes your mouth a little bit more dry. And I grab some water and I water swish, keep the mouth moist so the bacteria levels don't grow. They love dry environments. And so a dentist has a really big pivotal role here. If you see gum disease, It's not just for keeping your teeth in your jaw and not losing your teeth. And it's also related to, as we said, cardiovascular issues, heart issues, and now Alzheimer's. And so sleep, look at those symptoms or those red flags, such as the grinding of the teeth, the large scalloping of the tongue, high arched palate, retruded jaw, dry mouth issues, and discuss with your patient. They need to be evaluated with a home sleep study, get on their hygiene program so that they can reduce their chances of many things, including Alzheimer's.
Amazing. Thank you. You obviously have a big educational role in the stuff that you do, but I'm just trying to ask, really, how are you helping practitioners going from being aware of these issues for education to actually implementing solutions like some of the things that you've discussed?
Yeah, and that's done really through my coaching program. And the reason why I put the program together is because you can learn the online training on how to look for sleep. I have an online module. Within a few hours, you'll know exactly what to do, but then you got to implement. And what does implementation mean? Where do we send for the home sleep study? Don't buy your own equipment. It's hard to manage all that while you're doing a bunch of other things within your practice. And so I have my doctors refer their patients to a home sleep testing company. They'll handle the sleep study. They'll get the medical doctor diagnosing that sleep study through that home sleep testing company. And then you get the results. I bring you in, Andrew, and we go, hey, we were right. You have mild, moderate, severe sleep apnea. This is your results that signed off by a board-certified sleep physician. And these are your treatment options, which are CPAP, oral appliance, or surgery. And majority of patients fall under mild and moderate. They're great candidates for a mouthpiece. The ones who are severe, based on that home sleep study result, should really try the mask. If they fail and they cannot tolerate it, just like I did, you can still provide a mouthpiece as a dentist. You just can't have that expectation that they're going to be cured and healed, but it's better than nothing than leaving them at that the severe state. There's also surgical implications that they can be referred to an ENT for surgical evaluation. A device called Inspire for severe patients is a little device that's built in surgically underneath your chest muscle here. It's attached to your the nerve for your tongue, and it sends little impulses, little electrical impulses, signals to the tongue to keep the tongue kind of taut and not flaccid, so that it doesn't fall back and it can cause obstruction. So in severe cases where an oral appliance cannot work because they're severe, they can't tolerate the CPAP machine, the Inspire device has become very popular over the last decade as a surgical intervention. So the system has to be in place for what to look for in the mouth, what to look for in the medical history, the way to have the conversation with your patients, and then ultimately be able to have them get a home sleep study because no one has time to go to a lab. So remove that barrier for them, have them do it at home, get diagnosed, and then ultimately know how to treat the patient through those three different modalities of oral appliance, CPAP, or surgery.
Thank you. Are there any clinical tools or protocols that you think are being underutilized in this field, in your experience?
Well, I mean, the problem is like in dentistry, we're looking in the mouth all the time, and we're shy to scare the patient and tell them what we see sometimes, right? We're people pleasers, and we have to create a relationship so the patient doesn't go, oh, Dr. Rad is trying to sell me something. That's all in your mind, by the way. If someone looked in my mouth in 2009 and said, hey, Dar, are you sleeping okay? They saw the grinding of the patterns. They saw the large scalloped tongue. That could have saved me from this accident, And so we got to get out of our heads. It's the limiting beliefs that physicians and dentists sometimes have that we may not want to discuss this. This is not in my scope, or this is, the physicians we like to stay in our lane and just do cardiology. Well, if you're an oncologist, if you know that University of Wisconsin studies showed that 5 times higher risk of cancer of any kind, and you know that there's a cancer risk for sleep apnea patients, and you just got a patient for the 5th time today that you diagnosed for cancer, how are you not doing a sleep apnea study recommendation with the sleep doctor down the street or in the building? It doesn't make any sense that you're just focusing on what you were taught when you know that there's a relationship with sleep to so many different medical conditions. Cardiologists with arrhythmias or high blood pressure, that could be a result from sleep apnea and sleep apnea only. And so if you get them on an oral appliance through the mechanism of getting them referred to a dentist that does it in your area or a physician that provides the CPAP machine, there's a high likelihood that they're remission of cancer or the treatment of cancer would be successful. There's a high likelihood that they may get off of high blood pressure medication, and their arrhythmias may resolve themselves because their heart isn't erratically breathing to get oxygen to their brain. So this is the biggest frustration point, is there's so many comorbidities with different medical specialties that are correlated to contributing and contributed from sleep apnea, but everyone wants to stay in their lane. And that is my goal. And I'm standing on top of the mountain and try to scream as loud as I can for not just dentists to look in the mouth and see those signs, but also the physicians to be able to ask that question: how well do you sleep at night? I just diagnosed you with cancer. Oh, I sleep like crap. I wake up 10 times to go pee. My wife tells me I gasp for air. Oh, well, maybe we should also have you go talk to sleep doc down the street and have that evaluated, because that'll help with anything else that we do, let alone your quality of life.
Thank you. So let's switch gears a little bit to the business and operations side of what you do, because you are running a business at the end of the day, or businesses. What's working particularly well for you at the moment in your world?
Well, the hardest thing to do is doing it all. When you have patients and you have a practice that you're running, of course, I have an associate. As I mentioned, I'm only there 5 days a month now. You can't see patients all day, 4 days a week, and try to do anything else, such as speak, lecture, coach and train, or develop products. These things take time. A lot of time. I hate social media and I love social media at the same time. I think it's completely changed the dynamic of how our children are learning things, what they view as real, which is really not that real, because ultimately most people are posting the best things that are happening in their life and the best situations and cases and whatnot. But I do believe social media is a great tool to educate the masses. That has been the connecting tool for all 4 of my different kinds of businesses, with my dental practices, with my speaking, with my coaching doctors, and with my products. It's given me a lot of opportunity. I think that's maybe how you and I met as well, is through this network of LinkedIn and Facebook and Instagram, to be able to, and YouTube Shorts. You gotta post stuff. If you're a clinician, Google, as of July 2025, is pulling for the algorithm for recommending doctors based on posts on Facebook and Instagram. So your social media posts now are very, very important, whether it's in the medical field or in any sales of any company, of any product. Those posts now are being pulled for search engine optimization. And so you got social media is become the link. We're in it. AI's in it. We're in the trenches of AI. And how do we get recommended on AI? How do you get recommended? How do I get recommended when someone's speaking into their phone looking for a dentist that treats sleep, right? So you got to know how to reverse engineer the recommendation through AI. And you could just ask AI for that, by the way, and it will let you know. But posting a lot of blogs on your website, Q&A format, that helps a lot. Making sure your Google page is optimized, posting things on that as well for your businesses, no matter what business you have. And then making sure you post as much content as possible with your captions and your hashtags, matching to words that your clients or your patients would ultimately search for. That's the ticket to making all the businesses as successful as possible.
So social media is a double-edged sword. There's all the advantages of it, from what you've been saying around promoting yourself and being found, and then the frustrations that go with it. But was there anything else that is a frustration in the work that you do, whether it's on the sort of the more managerial side or the nitty-gritty of the admin side? What are the things that kind of are time drains for you, or bottlenecks?
Yeah, the basic running of a practice or running of a business with, the HR and the payroll and all that is really, really, it's not easy to do. And some people have managers for their practices and help with that, which can alleviate the pressure. You have to have the proper systems in place. You can't just, you have to be organized, right? And there has to be set times for you to do certain things. Within my practice, for example, I have a system where I know what days I'm going in, what days I'm not. Even on my schedule today, there is an hour for me to be able to just go for a walk. You can't just constantly keep working. You have to create some time and space for your mind to calm down. I don't know, Andrew, do you meditate at all?
I do, absolutely.
Okay. Yeah, so I've been through the works of Dr. Joe Dispenza. I went to his retreat a few weeks ago as well, and I do believe that there's that balance and harmony. Really, it's more harmony that you need to set aside somewhere between 10 to 30 minutes, if not more, to be able to go into gratitude in your meditation, go into an abundance mindset, and then all of a sudden things will come to you. You will actually see synchronicities follow through and come to you. So you're not in this constant race, of providing and protecting and doing, and I'm not doing enough. And, once you get into that gratitude mindset, you'll realize how much you've done is a lot and enough. And then you'll create more space for things to come to you as opposed to you chasing it.
Thank you. So if you had a magic wand and you could fix one thing in the business or coaching model or the practice model or the wider world of dentistry, what would it be? You only got one wish.
It's when you turn the age of 45 in the United States, at least, I don't know how it is in other countries, it's recommended that a person goes through something called a colonoscopy, and so you voluntarily drink something for 24 to 48 hours, and then you go in and you get put out. And you get, scoped and hopefully they find nothing. And if they do, they, take it out and biopsy. And that's recommended at the age of 45 as standard of care because 1 in 23 people in the United States have colon cancer. We talked about all the relationships to sleep apnea, all the comorbidities, the cancer risk, the heart attack, the stroke, the mental health, the dental concerns that can happen from grinding and acid reflux and all diabetes type 2 and erectile dysfunction and all these things that it can affect. Yet there's no mandatory, let's call it high recommendation sleep study for anyone that turns 40. That would be my magic wand is making that standard. Home sleep studies are recommended for anyone over the age of 40. I don't care whether you're, overweight, underweight. It makes no difference because imagine of all the medical issues that you could reduce. Imagine how much energy people would have more for their kids, for their family. Imagine how many more relationships you would be able to save. Imagine how much medical expenses you'd be able to reduce just by knowing and having that power through a simple home sleep study and ultimately getting treated simply through an oral appliance if you're a candidate, mild to moderate. And if you're severe, trying that mask and seeing if you can do that. So that would be my magic wand is making this a mandatory, whether you're at a physician, a dentist, makes no difference. It's part of your journey through life is when you hit that 40 mark, get a home sleep study.
Great advice. And obviously there's a huge number of patients out there that probably are uninitiated and don't know they need somebody like you. But what if they all showed up on your doorstep next week in terms of you had a huge demand for your services? What would happen?
I mean, that would be an exciting time for me because, nothing's better than when you treat a patient with an oral appliance and they come back and the wife comes with, and I'm like, oh, hi, I haven't met you yet. She's like, can I just give you a hug, Dr. Rad? You literally saved my marriage. And, I always go to all the comorbidities and the risk factors that we reduce. And, if I had a line out the door for creating sleep appliances or helping patients with home sleep studies and ultimately maybe directing them to other physicians as needed, it would really make me feel fulfilled. At the end of the day, I fell asleep at the wheel. I crashed my car. I had arrhythmias that I had to deal with. I was not as a happy-go-lucky person. Grumpy Dr. Rad was my nickname in the early morning until I got settled in my practices until I made my oral appliance. So, man, it would be a lifelong fulfilling prophecy if I could help even more patients. But the best way for me to help them is through helping physicians and dentists become aware, and dentists in general, to become have that ability to be able to treat. If I can help a dentist in a city, they can hopefully help dozens, if not hundreds, of their patients. And so through me, hopefully we can help thousands and thousands of patients worldwide.
Brilliant. So looking ahead, where would you like to take things over the next 6 to 12 months? Is there anything on the cards, anything you're working on? Where are we going in the future?
Yeah, I definitely want to travel internationally and speak on this on stage and get the motivation and the power going behind this to be able to have other doctors listen. I'd love to get the MDs more motivated, including oncologists and ENTs and cardiologists, which is the biggest three, I would say, that could help and with sleep. And I'd love to have a collective and joining of the dental and medical education being done together. So meaning dentists speaking on about this in medical conferences and physicians speaking to dentists and letting them know how much they're needed. And I think that bridging the gap in the next 6 to 12 months between the two sides would truly help become more top of mind for the treatment and screening of sleep apnea so that we can better serve our patients.
Is there one thing that you wish more functional and dental practitioners knew about airway work before getting into it? I know you've talked about a lot of different things. If there was one message that you would really like to drive home that they really understood, what would that be?
Yeah, remove your fear and just do it. I mean, you pull teeth for a living. You drill enamel that's, the hardest thing in the body off someone's, tooth. It's not that difficult. Don't be afraid to make an oral appliance to help a patient sleep better. Get out of your own mind of, I don't know how, I may hurt the jaw, I may change the bite. This patient may die of cancer. This patient may die of a heart attack. This patient may fall asleep at the wheel and crash into a family. What if it was your family and they crashed into? It only takes one moment, one incident, one patient that has that experience that you could have helped reduce or prevent. So get out of that limiting belief that you can't do this. Educate yourself to how to do it. Implement the systems and help start treating patients. Start with yourself. Start with a family member. Troubleshoot with your staff. And then maybe you can feel comfortable enough that you start making this a daily requirement within your practice.
It's a really sobering and profound message. I've got to ask you about AI. Do you see a role for AI tech platform in supporting patient education or diagnostics or some aspect of this kind of work?
Yeah, I love that you mentioned that. I'm actually working right now developing my own AI software where you could take, in conjunction with a company called Dentulu, and the CEO is one of my good friends. You could take a picture of your face, profile picture, a few pictures of your teeth and your tongue, and answer a few questions, and it will help assess the risk for you. And ultimately, we're doing it for children as well, on how high the risk factor is for you having sleep apnea. And so that's going to be through an app that we will be pushing out through my website, drrad.net, drrad.net. That'll come out in the next month or so in 2026. So I'm excited about AI being able to help self-assess people. And then ultimately, once we see if you're at a high risk, what will be the directives going forward, which is you can order a home sleep study here, get a telemedicine conference here. So there's no just, now I know, what do I do? There'll be a directive on how to help screen and ultimately get tested and then get treated.
Dar, thank you so much. This has been such a fascinating conversation, great information, great education. I think a lot of listeners are going to walk away with a new appreciation for the role of dentistry and whole body health. But I'm so indebted to you for spending your time this afternoon talking to me. Really, really, thank you so much.
Thank you for providing the platform, and I hope everyone sleeps well.